Today we learn something about diabetes mellitus, blood sugar testing in patients of diabetes mellitus. My name is Dr. Amrit Kejriwal. Channel's name is Heartbeat. There are various problems when I come to patients and they don't know how to do the blood sugar, and it leads to a lot of mismanagement. So patients do not follow instructions properly. Before the blood sugar testing, sometimes they stop the medicines, and this leads to wrong values. Sometimes they don't take the sugar tablets when they are supposed to do the testing, and it leads to mismanagement of diabetes, and it leads to great confusion and unnecessary complications and harassment both for the patient and the doctor. So blood sugar may be done by capillary and venous blood, both. So what is the venous blood? Here's your forearm and here's the vein, and here's the needle, and this is taken up from usually somewhere near the elbow. Capillary blood is done by a finger prick. Over here you can see, and this is the needle. These needles are particularly more thinner, and here is the blood which comes over here. You can see, yeah. Venous blood is not supposed to be used on the instruments meant for capillary blood. These glucometers are specially designed only for capillary blood. Just suppose you're going for a lab test and you do the venous blood, don't use that on the glucometer at all. So there's a difference. Venous blood is more accurate. You can do all the samples, HbA1c, FBS, PLBS, random sample may be done. Lab processing may take time and it requires laboratory assistance. Again, capillary blood is less accurate. HbA1c can be done by capillary blood also. There are newer glucometers which check the HbA1c by a finger prick. FBS, PLBS and random blood sample may be done. You get the immediate results and may be done by yourself. Doesn't require laboratory assistance. Venous blood at the same time as done as the capillary blood is usually lower by around 10 milligrams per deciliter. That is normal phenomena. Blood sugar testing. Various tests are done for blood sugar such as HbA1c, fasting and postprandial blood sugar, and random blood sugar. So HbA1c, it can be done at any time. Fasting is not required. Gives average of last 3 months. Has its own limitations. I have made a separate video only on HbA1c. FBS. Done after fasting of minimum of 8 hours. Some people recommend 12 hours fasting. You may drink water during this time. When you're doing the fasting blood sugar, take your medications as usual as night before, but don't take them in the morning. And you can do it by capillary or venous sample. Venous sample is always more accurate than the capillary blood. Do not take the morning tablets. PLBS. Ideally to be done 2 hours after lunch. Take your meals regularly. Take your medications as usual, tablets and injection insulin. Capillary and venous sample both may be used. Again, venous sample is more accurate than the capillary blood. Random blood sugar. This may be done at any time. Venous sample is preferred, but capillary sample may be better in an emergency. And it gives immediate value. Precautions. No point in doing HbA1c if there has been a change in medications or diet recently. More details about HbA1c I have given in my separate video, and it just gives you basic information. FBS, PLBS maintain the same diet and medications for the previous few days. Many patients, they eat a lot of sugar and sweet items, and when they go to the doctor, they change their diet and it leads to false readings. Continuous monitoring of blood sugar is another new thing that has come. So it requires a special device, works through a sensor placed on stomach or forearm. measures blood sugar immediately 24/7, and this may be connected to an insulin pump which can deliver insulin separately, and this is recorded on a receiver. Again, costly affair, may be beneficial for selected patients. Thank you for watching the video. Please do not forget to like the video. Feel free to give comments. Please subscribe to the channel and share link with your friends. Thank you once again.